The start of the pandemic in 2020 rapidly taught member states and the peoples of Europe that if you're going to have a space as economically and socially integrated as the European Union, you also need to have public health that is capable of managing threats such as this and future pandemics. Member states' institutions rapidly rose to the challenge and both expanded and created new European public health measures, so dramatic that we needed to do a third edition of the book.
There have been a few key turning points in the history of the European Union's role on health. It started originally with very, very niche activities driven by the issues of the day, and those were things like HIV/AIDS, like cancer, like drug dependence. But one of the real turning points around the Patients' Rights Directive came from some court cases. And those court cases, to make a very long story short, were about taking European Union rules and saying that these rules gave people rights to health, not health rules, because the European Union didn't have the power to make health rules to give people rights to health, but internal market rules, free movement of goods, free movement of services. And the court, European Court of Justice, agreed, said yes, people do have rights to be able to use their rights to healthcare across borders within the European Union. And the Patient Rights Directive was a way of putting a legal framework around that to give patients certainty about how they could exercise those rights. The power that it has, it shows that the European Union does have a role, that there is this European dimension, and that has created expectations and a legitimacy to European action on health that wasn't there before.
I think that the book is really relevant to European health managers because it provides an evidence-based, clear summary of really what the key issues are for the health systems. It makes the information accessible, it's trustworthy and reliable, but it also provides it in a context that's broad. You can look at all of Europe and not just get stuck in your own country or your own specific issue, but you're able to see what's happening across Europe. And in that way, it enables you to think more broadly, and it's very interesting for that way. And I think for health managers, it also connects them into how decisions are made and what some of the policy contexts are, which may not otherwise be part of their daily work that they would other come across in their country setting. So in that way, it opens a lot of doors and gives a lot of big insight thinking. I'd say that's actually quite similar for NGO leaders. Like for us at Emma, we're an NGO, and although we're a membership organisation of health management, when we're in Brussels planning our work as an NGO, it provides us with a similar insight. Again, it's trustworthy, reliable information, so we know that it saves us a lot of time in any research that we might otherwise have needed to do ourselves. It's reliable and it's really insightful, and it creates for us foundation pieces that we can then build our work on rather than trying to figure that out for ourselves. It saves us time, it saves us energy, and it gives us really a trusting foundation to build the next steps on.
This book introduces EU health policy, and in particular the chapter on economic governance introduces the third phase of EU health policy. So by that third phase we mean essentially the EU's fiscal and economic governance framework and how it impacts upon health. And so within that chapter we just quickly cover three sections. So firstly, a history of economic governance and where it's come from and how it affects health. Then we look very specifically at the European semester, so this annual cycle of making recommendations to member states and how health is included within those recommendations. And then we wrap up with the COVID period, so looking at how that framework has changed through COVID and all of the new funds that have become available as a result of the pandemic.
The Observatory had also always a role in EU health policy because you cannot separate the single European market from health systems. The free movement of citizens, services, goods, capital is also the free movement of patients, health workers, pharmaceuticals, medical technologies, and investment in health service. So that belongs actually together, and it requires analysis and sometimes also a little bit correction. But moreover, it's not only about health systems, it's also very much about the determinants of health, because there are many competences of the EU which relate to the commercial determinants and also social determinants. Just think about agriculture, which is a competence of the EU, and trade, both very important. So we need to look into this, we need to analyze this, but now we have a slightly different situation, because with COVID-19 and the responses from the EU, it became clear that European Union has a role in supporting health and health systems in the Union and the member states. And I think that this requires really some further scrutiny and analysis. And that is why we have updated actually the volume before its time, next issue will be out in 2024, and we have also thoroughly revised the outline of it and expanded it because so much has actually happened.